Arthritis is going to come in two different flavors. You're going to have osteoarthritis and rheumatoid arthritis. Both of these are going to cause joint pain, but have different causes and different presentations. And so osteoarthritis, this is your classic wear and tear, just from joint degeneration over time. Whereas rheumatoid arthritis is actually joint inflammation from an autoimmune attack on the joints. So keep this difference in mind. Now, you can see the difference here, where in a healthy joint, we normally have this cartilage cushioning this joint space, but then as that wears down from wear and tear, you lose that joint space and basically have bone on bone when they move, so very painful. Rheumatoid arthritis, also painful, but this is more due to that autoimmune attack on the joint that gives it this inflammation, swelling, and pain. So the NCLEX isn't going to ask you to interpret a knee x-ray, but they do expect you to be able to tell the difference. So the first star point and key to know the difference is in your patient history. So somebody with OA, which is from repetitive stress, is going to have risk factors that stress the joints. The big one being obesity. So more body weight simply puts more stress on those joints. Or the NCLEX might say your client is a mechanic or has some other job where they crawl around on their knees all day. Versus RA, which is an autoimmune condition, these patients are going to have findings of systemic involvement. So things like fatigue, anorexia, and if we draw their blood, they're going to have an increased ESR and CRP. Those are your inflammatory markers. So OA isn't going to have those things because it's local, versus RA has systemic findings. So remember that difference. And would you remember which joints are affected in which? So remember, OA, being a condition of repetitive stress, is going to affect the most stressed joints. So those are going to be your larger weight-bearing joints, classically your knees and your hips, versus with RA being this autoimmune attack, your smaller, more delicate joints like your fingers and wrists are going to be most sensitive to that autoimmune attack. You'll also want to remember whose pain gets better with activity versus worse with activity. And remember, OA, again, being wear and tear from repetitive stress. After we start moving those joints around and wearing and tearing on them more, that pain is going to get worse with activity. Versus in RA, we're going to have inflammation that builds up on the joint whenever it's still. And then when they wake up in the morning, they might have really stiff joints, but then once they start moving and using those joints, that helps their body reabsorb that inflammatory fluid and improves the pain. So remember this distinction. And the stiffness works the same way, so it won't really help in osteoarthritis as they move around, but it will improve very quickly with RA as they get up and start moving around and reabsorbing that fluid.